questions too. So the table, Larry's table, Donna? Anyone there with table questions?
We put it on Paula.
Okay.
Well, we had a lovely conversation. And we had a couple of things. One is, how could the HIA process help break down the silos of, people who are working on different kinds of issues to address the problem from a more holistic perspective? And then also just like the feeling that we don't need more studies. We have information. We know what the health impacts are of all kinds of things. So how is it that HIAs are really going to help us?
Oh, that's another great question. Any one of our panelists want to take it on? Yeah. So one, breaking silos, and we don't need more data.
Yay, that's what we were discussing up here. So I'll jump in first. And in terms of silos, HIAs brings health to the table of whatever the project is that's going on. So it's kind of a way that you can say, and it potentially brings money. All three of us are funded at different levels. So it helps bring, even if it's a small amount of money, to the project. So it gives you clout at the table to work on whatever. So I'm working with engineers. I'm working with urban and regional planners. I'm working with environmental people. And I think that's what HIAs really can do, is to help bring people together at the table. And then it also helps them to see how health is impacted, and it helps them with their language. So you're developing kind of some common language that includes health.
And I'll just add about we already have research. I agree with that, and especially in the criminal justice system, we know the disparities. But one of the things we don't have in the criminal justice system is this health lens. There's only like maybe one or two other HIAs that are focused on the criminal justice system. Primarily, they're focused on environmental, location type things, but not really on the criminal justice system. And I don't think that we look enough at the health impacts of criminal justice policies on communities of color and low-income communities. So I see that there is a room for health impacts in the criminal justice area.
Yeah.
Wait, Terry, I think.
Sorry, Cecilia.
Oh, I was very minor, but I think the opportunity for the cross-sectoral comes with the community stakeholder process, because the community doesn't look at things from a sector base, right? I mean, they look at it from sort of a reality based of all the different influences. So to the degree that you have strong community input, that enables sort of being able to look at things creatively and innovatively. And I agree. I agree in terms of the research. I think there's a ton, research. That's what I do. So I agree there's a lot of data. And I do think for the communities, particularly my community, the Native community, and a lot of communities of color, the first thing I hear when we talk about it is, we don't need any more studies, we've been researched to death. The reality is we've been researched from a particular vantage point, though. It hasn't been from our vantage point. And so we try and bring that forward and say, yeah, you're right, you've been researched to death in this way, and now it's time for us to research ourselves to life. Because we need that information to be strong advocates for ourselves. And so that's the part that we need more information on.
I disagree on that.
Yeah.
Respectfully, because the research that I read, I don't take a particular lens, because they don't know about us like we know about us. And reading that research, the question that you had here was, how do you guys intersect it together? Do you collaborate together to make it a holistic? You might work in criminal justice, you're working environmental, you're working in this, but working together, even though you have different funding sources, you know what I'm saying? It's really important.
Do you mean the three of us working together?
All of you are working on different things, but they all impact each other.
That's true.
And so collaboration needs to happen not only with you, with the stakeholders, and with the communities that will be impacted. But we don't need additional studies. It's already there. And it's been done by lower wealth and people of color. We're getting surveyed all the time. We give that input.
And I think the difference too with just the health impact. So our study is looking. So when we look at the health impact, we're looking at a specific policy. And if we drug sentences, what is that's going to have on communities of well, all communities. So with our HIA, we have to look at all communities, but we have a particular focus on communities of color. So that has so the purpose of the health impact is really supposed to have a policy and a pending decision. So you're not doing research just for the sake of exploratory. It's research to answer a question, to answer some sort of pending decision that's going to be made. And so I think that it does have benefits because we've already made these policies without considering the health impacts, without considering the racial impacts. So it's sort of like the racial equity studies that you see. You know, what are the consequences going to be?
And I want to speak to that as well. I think we do have, I agree with Don, I don't think we have an exhaustive amount of information in that particular area. However, we already know that it is impacting various communities. CDC has been doing this work for years, and so we have an exhaustive amount of information that, you're right, is segregated to a certain area about what happens when we have drug use, the impact, how it impacts the disparities, recidivism, and all of that. And we also know that how does that impact poverty, how does that link to the rest of the families. And so I think that what you're saying is valuable for today, but I also think that we have an exhaustive amount of information that we can take and look at that and look at this together, and then have a broader brush so that we can say it not only impacts those folks that are incarcerated, but it impacts their families, it impacts their community, it impacts our environment. And so when we start looking and bringing out that information that we've already gathered, and we've spent billions of dollars, and we've stockpiled that information and not used it succinctly, then how do we take that information and use it collectively and add to it the parts that are missing? So I guess, I think I see it as a both and.
And that's a key component of the HIA is to gather the data. So to do the technical term literature reviews, but to gather the literature and to use what is out there. And then Pew is also great about bringing us all together. So everybody that's doing an HIA is talking to each other at a conference and having ongoing conference calls and technical assistance so that we are not recreating the wheel, but utilizing what's already been done.
Great. No, perfect timing. Table Yolanda's table back here, the mega table apparently. So, question?
Well, just to summarize, we had talked in this group about different perspectives on the value of the tool itself. That HIA seemed relatively new, more multidimensional form of integrated analysis, which is really, you mentioned about environmental being what's sort of in the past, and that's not as complete a planning format as what we heard from you. So we were talking about how do we drive the adoption, or is there a value to drive HIAs as kind of a more multidimensional tool for policymakers to make decisions? And how do you get that? Because it seems like it's a relatively new sort of following in these big data or data approaches. It sort of sounds like an evolving framework that would also include racial justice and equity and a variety of other things implicit in it. So how do you each see policymakers making this a tool that's there for them, that's going to be used, and that's going to be consistently, it's not just going to be dropped as another technique that can be used to move these issues forward? Those came out in the discussion.
Well, it's a tool. It's a voluntary tool. It's a tool. And I think we were having discussions up here in terms of, what does structural racism and structural inequality really mean, right? And that's, so an HIA, in my opinion, is a tool, and it's only as good as the people who want to use it to address those structural inequalities and be diligent and creative about using it, but once it's done, you're absolutely right. What's the next step? When I was just on an EPA. EPA has what they call science advisory boards, which look at different policies, different systems, like what's the best science to address a particular environmental problem. And we just got done developing the Science Advisory Board for an Environmental Justice Technical Review Guide. In other words, this guide is supposed to help EPA look at how do you actually assess what the EJ consequences are of any rule, right? So the Science Advisory Board just got done saying HIAs are an important tool in that process. They're not the only one, and they have to be supplemented by all the other research that you're talking about in order to do that. Got done with that. EPA itself did this. The Clean Power Plan came out, and EPA did absolutely no part. It did not engage. It did not take its own Science Advisory Board's advice and develop an EJ analysis. And one of the most significant rules to come out in the last 10 years, the Clean Power Plan, which is supposed to deal with climate change, didn't do it.
That's a political decision.
That's a political decision, right? And that's what we're talking about.
Using the analysis to make it to get a result.
Yeah, and that's where, yeah.
So I just want to say for our HIA, we include the policymakers. So they were instrumental in writing us letters of support. Because we don't want to do this if we're going to just do it and then they're not going to listen to us. So they wrote us a letter of support. We got a couple letters of support. And they're a part of our stakeholder, our committee, and from both parties. And so that's important as well in all levels. So I think including them in the process is crucial. Either informing them about the HIA is step number one, but then also if they can be part of the HIA on an ongoing basis, that's important.
Table up here.
Well, we was discussing policy. Cecilia was talking about, and everyone was talking about these policy makers. She made a statement, and the other young lady, Karen, about Nixon and some of the other people about these policies. Now, all these data and all this analysis that you guys collected, knowing that it's not helping the people of the community, what is the problem? What can we do? What is the problem that there's been 20, 50 years or more, and realizing this is not helping the community? Why do we still have the same policy in place when you guys collect all these data issues and all these things that result, that got proof, saying that this is not helping, but yet again we come back to the same table discussing the same issue? And I just want to know, what is the problem of changing that policy 50 or 60 years ago when you got data now stating that this is what happened to the community as far as its health concern, and we still back at this table discussing it?
And we also talked about like smoking, public smoking policy, how quickly that kind of turned around. So why couldn't the same thing happen for something like
Yes.
community health?
We would like to know.
I think that number one, I think that it's about whose community is impacted. So I think the reason why criminal justice policy doesn't change is because it's not, the policymakers aren't, like if you look at DWI and stuff, you'll see some stuff around that because everybody, more people, but when you look at like drug policies and, disorderly conducts and lurking and low level, the policymakers, they don't have friends, family, community members who are impacted by those types of policies. So there's not a sense of urgency to change those policies because it doesn't directly impact you. And then also you don't have the lobbying power. These communities of color and low-income communities and don't necessarily have the lobbying power. We're seeing in the criminal justice system that change with the Second Chance Coalition and other coalitions coming about. But I also think that for the area that I am, we are seeing changes. Like it's slow moving, but the fact that we have Ban the Box, that's huge. The fact that we have a criminal expungement policy, that's huge. Could it be better? Yes, it could definitely be better, but the fact that we have a policy is huge. The fact that, right now, the voting, having people vote that are on probation and parole, if that passes this session, that will be huge.
Correct.
So, and then all of that came about because of the research that showed the impacts of having a criminal record and the difficulties of people moving on. So I agree that we have a long ways to go and we don't utilize research as much as we could, but I think slowly but surely it's coming.
Do you know, and I guess I want to add something too, because a lot of this has to do with strategy and how people frame their persuasive arguments or not. And smoking is a great example. Actually, the Clean Indoor Air Act was in 1973. So that's only 3 years after NEPA that started the whole environmental impact process. And it did take us this long to get to smoking. And what happened in the 80s and 90s was if you were around and watching television, they were trying to shame smokers. So it was, you need to quit smoking, it's a bad thing. And then they had the scare tactics of the person smoking out of the trach also, if you've seen those commercials. So what changed it really fast was secondhand smoke. So it was public health who said, that's not working, let's talk about other people, it's those other people. And then that's what had the laws start to happen. It's kind of the same thing with gay marriage. Once a couple of things started happening, then the tide just turned, and now we've got smoke-free nationwide, basically in many, many states, and the same thing with gay marriage. So I think it's a persuasive argument. It's people who can who have passion and who can get people to follow and listen to them. I think is a big piece of it. Wes Stephen?
That was the environmental piece. What happened to the policy?
Oh, you want me to answer that?
Yeah, I do. And
Is Ned here?
Karen, I understand what you're
Ned
saying.
left.
But if you're still collecting these datas, consist of people, I understand about the criminal justice thing, but this is about the environmental and health issues. If all this thing is being collected and data and stuff, I don't understand that far as getting some action going or doing something besides continue to have these form of these type of meetings, talking when you already have some type of information stating that this is going on with the people. They don't, not only in the most of the color neighborhood, but as far as low income neighborhood, period. That type of piece.
Yeah, I think it's one answer is exactly the answer that's already been said, and that is the political power of those communities that can't advocate or don't have the same resources to advocate around pollution issues is inherently a structural racism, a structural inequality issue, right? So there's that piece. I think the second piece, and it may get to what people were talking about in terms of the data. I'm not an anti-science person, but I will say that the methodologies that have been used to assess risk, health risk, are very incomplete. And so there's a whole structure of what kind of research gets done that doesn't address exactly what you're talking about. So it's a research like in terms of what is the pathway of the pollutant and what's the impact on the individual body. But when I say that's the wrong kind of research, it's an important piece of the research, but the research that then gets at what's the full impact of the community, what's the cumulative impact, that actually has been something, and I'll borrow from Ebony, that the environmental justice community has been advocating hard for the last, since the 1980s. We have been pounding the state. That's why I was hoping Ned was still here. He's the environmental justice liaison for Minnesota Pollution Control Agency. That would have been a perfect question for him, right? Why is it that we still have this situation here? Pounding in terms of advocacy, we have to then, in order to convince them and in order to convince legislators, we do have to have the data. to show them what this impact is. These are strong political issues. These are strong political issues that are at heart.
I guess.
Sorry, what do I get? Sorry, let me. Well, let's save it to the end, but we want to get to this one table because of the timing. So we will hold your question, but we want to get to the table here. Last table.
We had a couple of questions, but
Okay.
we picked sort of a fun one. So if you,
I like
in
fun.
your perfect world, what's going to be different because you went through the process of doing an HIA? What's going to be sort of the end that's fantastic and wonderful because you did this?
Well, for me, it would be that people are not criminalized because they have a drug problem. That it's more of a treatment model than we use a criminal justice model. And then also, you know, we look at having more equitable disparities in drugs. We know that most of the policing happens at the community level, but those are low-level drug offenders where, you know, we don't see as much enforcement as the ones that are trickling that down into our communities. So I guess more equitable drug sentencing policies, but then also the treatment.
For me, it would be that the Botno Transitway is just the coolest transit line that has everything that people want. I mean, we've gotten great input from all these different communities, and if money were not an issue, we could just really have these great transitways. So it would be that the findings of the health impact assessment really get implemented, that people could bike and walk and get to the transitway and have great jobs and then have access to health care and food and everything.
I think it would be similar, that our neighborhoods that have the highest pollution and health risks for them are actually vibrant. They have great jobs, sustainable jobs, good transportation, living wage jobs that have upward mobility, and that the housing that people live in is like zero energy, prime, sustainable, fun place to live.
So now you get to talk about it.
Yeah, uh-oh.
You should have gone first.
Yeah.
That, I mean, I hear everybody making reference to jobs, right? And we talked about this at our table, the economic component, how important that is. And with that in mind, I think that what is it that you, out of these studies that you all get, how can you all actually attribute this information that you're acquiring from these studies to push the legislature, policy, you know, whatever, community activism groups, whatever, to focus all more so upon that? Because ultimately, if we have the resources, right, if we have that true equal opportunity, but then at the same time mandated opportunities that would create that space for people of color and low-income individuals to have jobs, how can we possibly, what is it that you all can do? Can you all aggregate that and make that happen?
Well,
The data, can you aggregate the data?
Aggregate the data.
I can tell you of a
Policy to make that happen.
so I can tell you of a study that's out there that Yingling Fan did. She's a professor at the University of Minnesota, and she looked at the Hiawatha line because that's been up and running for 10 years now, and it's awesome. You would not believe how access to jobs has really made a difference in real people's lives in the Twin Cities because of the Hiawatha line. And so how incomes have slowly been rising for the people who use the line because they're able to get to and from jobs. They don't have to worry about having a car, which is often unreliable, especially if you can't afford it. And then you've got, you know, it's coming every 7 to 10 minutes. There's never an issue with light rail the way there are with buses. And so that's already out there. But again, that's a very specific area.
Didn't look at the gentrification of people that have lived there and now can't, so.
She did do some of that, actually.
It was really twisted to.
Oh, okay,
Yeah.
okay.
Yeah,
I
Sorry.
still really appreciate that study.
Yeah. I think that's
It's being able to live where you.
right.
Yes, yeah.
Right.
Now we have all these fancy things like transportation to get to a job, and we can't live here anymore.
Right. I think that's exactly the
important.
kinds of indicators that we're trying to do through our HIA, right? The indicators are, that's why I started with the place-based. And it's gonna have to be both, but I think in the past, there's been a tendency to to focus on getting people to jobs. And there has been less of a focus on how do you build jobs within the neighborhood and community, right? And so we need both. And so I think what we're trying to figure out in the HIA, it's in progress. I don't know the answer to this, but what we're trying to figure out is indicators that show, first of all, get the community's perspective in terms of what kind of jobs do they want, and what opportunities there are in the neighborhood for development, and trying to create indicators that say we want so many jobs, that X number of jobs that are only X number of miles from a person's home, right? And create indicators like that that are more place-based, so that then what we can say to the city, to the county, to the state, is when you're doing green jobs training or you're doing green jobs business investment, that's part of the indicator that you have to focus on those communities that don't have those jobs in that radius to start with. That's the best that we can think of at the moment. I mean, whether that's going to work, I don't know, but that's kind of like where we're trying to keep it as a place-based perspective.
Rondo, go ahead. Sorry. Yeah, come back to your question.
So, I still go back to, and I think all of this information respectfully is wonderful, and I think I appreciate the successes that each and every situational area that you're talking about has occurred. However, the question that I think I've overall heard, that we've asked overall, is how do we how do we build benchmarks into the data and to the efforts and to the grassroots efforts around that help to prevent or circumvent regression? Because everything that you're saying, we've been this way before. We've been to the we've maybe not focused on specifically offenders, but folks of color had to have people that were, in the 60s with Dr. King, and, when we talk about the garbage collectors, and when we've talked about all of these different types of poverty and voting and women and people of color, we are coming full circle right back, as she said, 50 years later, here we are again, and it doesn't mean that the work that you're doing now is minimized at all or negated at all. However, I mean, we talked about the same thing when that was the whole purpose of Rosa Parks in the first place, the bus line. So we're still back doing some of the same work. So how do we take what we've learned to help to circumvent regression, so that our policymakers can look at, here is some great feats that we have accomplished, and now 50 years later we have same or similar, we have grown, but we have some same issues. What do we put in, how do we aggregate the data so that it helps us to see, so that we're not regressive?
Well, I think I'll just speak to, I think it means, as those of you who have worked in this area in the past and were part of that movement and learned lessons, I think it's important to bring those lessons forward and help, I mean, I think we have next generation of folks that are in a different, that grew up in a different time, that have the problems are historical, and they move forward. I'm probably, well, I won't say how old I am, but I am old. and so I've seen that, process. I think the problems are a little bit different. They're not the same because the political situation is different from it was in the 60s. At least it is for the Native community. And I think that's the intergenerational work, right? I think what Ebony is trying to do in this kind context, at that, it is moving forward. It's trying to move things forward, and we need the lessons of our elders to come and say, we tried that, and this is not in the way of like, we tried that and it didn't work, so don't do it. But we tried that, this is what happened, and this, maybe can we think about it this way? And then together, I think with folks that are working on it, from a younger generation, I think that sort of builds those lessons of history. That's the best I can figure. I don't know, because that's the perennial problem, right, of doing social justice work, is always trying to figure out how to do change, but always knowing that whenever you make progress on one thing, there's it comes back in a different way, and you got to figure out how to then push that. And then once you make progress, it pops up in another way, and then you got to figure out how to deal with that. That's the nature of our work, unfortunately.
And I think that the policy we're working on is directly because of the war on drugs, because we had to get tough policies. So I think it's a result of what has happened historically in us not looking at that history. So we can't look at this drug policy without looking at the historical aspects of it and why it came to be.
Oh, sorry. Okay, my last question. I was concerned about the environmental for all minority and people that live in low-income neighborhoods. You say that it was a policy made, and we have to, back then, of a policy and the data. I wants to know what data, not searching everywhere to find the data, but what specific data or information or whatever it is that we need to collect to see what we can bring to make that policy change. Not keep coming back and doing this and doing that. What specific data do we need to make that change about that environment, for having for causes polluting and dumping this and this in community of minority and low income? What data do we need to collect instead of variety for one?
I'm not trying to be difficult. I'm truly not. Yeah. Let me give you an example, maybe a concrete example. Okay, I have a friend. Her name is Beverly Wright. She's from Louisiana. New Orleans, has the Deep South Center for Environmental Justice. Has a MacArthur Genius Grant, because she's been working on this stuff since, with the folks down and dirty for many, many years. She's been working on helping a particular town called Mossville, Louisiana, that is home. If anybody has ever heard of Cancer Alley, this is kind of like Cancer Alley. It's got like, I don't know, upteen refineries, petroleum refineries. The residents there have been subjected, they have like extreme health problems. This is a woman who's got the chops, she's done research, she's done everything. The Deep South Center has been involved in trying to figure out how to deal with that for the residents of Mossville. It's still not resolved. And Lisa Jackson was down there trying to help figure it out. Everybody's trying to figure out. The laws are such, right now, the laws are such that the capacity to make those changes is very difficult. Even when you have the data, this is the part that you guys are saying, even when you have that extreme case, that you have the data that people have these health problems, then the question is, so what?
Do we ask the legislators or the policymakers, what do you guys need in order for this to be turned around? Do we ever ask those questions?
They need to be directly impacted by it. I mean, or their constituents need to be directly impacted by it. That's how it's that's where real change.
That's so cynical. We have to wait until they're so.
But I'm asking the question in a cynical way. I'm not saying I believe that. I'm saying that is what we've seen has made change. That's what I'm saying.
If there's short questions, short questions. Real quick too, right before we leave, we do have a short evaluation while some of you are sitting here. Short question. Thank you for your vote. Short, and then again.
Short. Miss Ebony, this is
that people of color do not use drugs more than Caucasian people. It's the policing as well.
Yeah. Last comment. I'm so glad people are so passionate. Thank you. Yeah.
Well, I just wanted to say, I think, the general question of, well, how do we use the data, but how do we really make change? How do we keep dot magazine engaged? And I think, it is about political power, and I don't mean necessarily legislative political power, but it's about, because we can't go to the legislators and say, please do this and please do that, unless they have a bunch of people behind them out in the street. So it's about organizing effectively in tandem with using good data. And I think, then that's a good pairing of what we need. And I think just, maybe a quick example of a positive, successful environmental justice fight that, happened in California along the coast. There was a big company trying to build offshore pipes coming right in through Ventura, California, through a Mexican-American community. And a young Chicana woman, a teenager who was helping clean up the beach one day, said, what's that? What's going on here? And she was the impetus for, just getting a whole bunch of community people involved, and they actually stopped those pipelines from coming through. But it was a combination of organizing and good data, good information. And I think, that's, I think is the answer. We gotta do both. We gotta have this great information and be armed with good information, and we need to educate ourselves.
And the community building we do tonight is intentional in the movement, right? And so thank you so much, everybody. This is the last issue series of the year. If you have suggestions,